Do you frequently feel a dull pain in your lower back that gets worse when you are resting, especially at night? Or maybe you wake up stiff and need to move around to feel better. If yes, you are not alone, and it might not just be from sitting too long. What if it is something going on deeper, like your spine slowly becoming less flexible over time? This could be a sign of ankylosing spondylitis. AS is a type of arthritis that mostly attacks the spine, causing inflammation between the bones, vertebrae. Over time, this can make the spine stiff and even lead to some bones growing together. Think of it like rust slowly building in a chain. At first it is just stiff, but if not cared for, it can lock up. It often starts in young adults, usually before age 45, and is more common in men. So if you or someone you know has had long-term back pain that improves with movement, not rest, it is worth looking into. Now you might wonder, what actually causes ankylosing spondylitis? Well, doctors don't know the exact trigger, but they've found a strong link to genetics. Have you heard of the HLA-B27 gene? About 90% of people with AS have this gene. But here's the twist. Not everyone with HLA-B27 gets the disease. So, having the gene is like being born with a loaded gun, but something in your environment has to pull the trigger. That could be an infection, maybe a gut bug, or even stress on the immune system. Think of it like this: your immune system mistakenly starts attacking your own joints, especially in the spine and pelvis, as if they were invaders. It's not catching from others. You can't catch AS like a cold, but if your dad or sibling has it, your chances go up. So family history matters a lot. Let's play a quick game. Imagine your body a few years ago versus now. Can you touch your toes as easily? Do you wake up feeling like you slept on a wooden board? Do you feel pain deep in your hips that moves around? These are classic signs of AS. The pain usually starts slowly, lasts more than 3 months, and improves with exercise, not rest. This is opposite to common injuries. Some people also notice their chest doesn't expand as well when breathing, because the ribs can get stiff too. Others say they get tired easily, or their eyes become red, painful, and sensitive to light. Yes, AS can affect eyes, called uveitis. And in severe cases, the spine may curve forward, making it hard to stand up straight. It's like your body slowly forgets how to bend. If you've checked 2 or 3 of these boxes, it's smart to talk to a doctor who knows about joints, a rheumatologist. So, how do doctors figure out if it's AS? First, they ask about your symptoms and family history. Then, they might order X-rays or an MRI to look for inflammation or fusion in the spine and sacroiliac joints. Those are the joints connecting your spine to your pelvis. Put your hands on your lower back, the dimples above your butt. That's the area. But early on, scans might look normal, so they often do a blood test. No single test confirms AS, but they check for signs of inflammation, like ESR or CRP, and the HLA-B27 gene. Once diagnosed, treatment focuses on keeping you moving and reducing pain. The best medicine, movement. Physical therapy is like a personal trainer for your spine, with stretching and posture exercises. Medicines like NSAIDs, for example ibuprofen, help reduce pain and swelling. For stronger cases, biologic drugs like TNF inhibitors can calm down the immune system. These are often given as injections or infusions. Think of them like a software update for your immune system. The key, start early. The more you move and treat it, the better your spine stays flexible. Can you prevent ankylosing spondylitis? Well, you can't change your genes, so if you have HLA-B27, that part isn't preventable. But you can prevent severe stiffness and disability. How? By taking charge of your body. Imagine your spine is like a rubber band, use it, or it will dry out and snap. Daily stretching, good posture, no slouching on the couch for hours, and regular exercise, swimming is great, help a lot. Avoid smoking, it makes AS worse and reduces how well medicines work. Also, listening to your body. If your back hurts for weeks and feels better when moving, don't wait, see a doctor. It's like fixing a small leak before it floods the house. Prevention here isn't about avoiding the disease completely, but about living well and staying active despite it. Science is moving fast. Recently, researchers have been digging into the gut-joint connection. Did you know your gut health might affect AS? Studies show people with AS often have different gut bacteria. Some trials are testing special diets or even fecal transplants to see if fixing gut bugs helps. Also, newer drugs called IL-17 inhibitors like secukinumab are showing great results in stopping inflammation and slowing spine damage. These are now used when TNF drugs don't work. And guess what wearable tech and apps are being tested to help patients track their pain, posture, and movement in real time, so doctors can adjust treatment faster. There's even research exploring if we can predict who will get AS before symptoms start using genes and blood markers. So while there's no cure, yet the future looks hopeful with smarter treatments and better ways to stay in control.